Ever wondered how IVF works? Welcome to the intriguing world of in vitro fertilization, a revolutionary fertility treatment that's changing lives across the globe. From conception to birth, it's a remarkable journey. Join us as we delve into the IVF process. The IVF journey begins with stimulation. This is the first step in the in vitro fertilization process, where the magic truly begins. The woman embarks on a course of hormonal therapy, a carefully orchestrated dance of hormones designed to stimulate her ovaries. Now, under typical circumstances, a woman's ovaries produce one egg per menstrual cycle. However, in the world of IVF, we're aiming for a bit more than that. The hormonal therapy is designed to encourage the ovaries to produce multiple eggs. Why multiple eggs, you might ask? Well, the answer is quite simple. More eggs mean more opportunities for successful fertilization, increasing the chances of a successful pregnancy. This process of stimulation, while it may seem complex, is a testament to the marvels of modern medicine. It's a crucial part of the IVF journey that sets the stage for everything that follows. Once the eggs are mature, we move to the next stage, egg retrieval. Now we come to the egg retrieval and sperm collection stage. This is a critical point in the IVF process. Once the woman's eggs have matured, they are ready to be retrieved. This is done through a minor surgical procedure. A thin needle is guided through the pelvic cavity to gently extract the eggs from the ovaries. It's done with utmost care, and the procedure typically takes around 20 minutes. Meanwhile, sperm is collected from a male partner or a donor. This is usually done through a simple process of ejaculation into a sterile container. The sperm sample is then prepared for the next step of the IVF process. So here we have it, the eggs and sperm, the essential ingredients for creating life. Each has taken a unique journey to reach this stage. Now, they're ready to meet each other in the laboratory. With eggs and sperm ready, it's time for fertilization. Fertilization is a critical part of the IVF process. It's where science and nature collaborate in a fascinating spectacle. This process occurs within the controlled environment of a laboratory, playing out in one of two ways: traditional IVF or ICSI. In traditional IVF, the collected eggs and sperm are mixed together in a dish, allowing fertilization to occur naturally. ICSI, on the other hand, stands for intracytoplasmic sperm injection. This method involves a single sperm being injected directly into an egg. Following fertilization, these now fertilized eggs or embryos are not left to fend for themselves. They are cultured in a specialized environment for a few days. This stage, known as embryo culture, allows professionals to monitor their development, ensuring they're growing as they should. After the embryos have developed, it's time for the embryo transfer. This is the next exciting step in the IVF process. Stay tuned. The final steps of the IVF process are the embryo transfer and the pregnancy test. Following the embryo culture, one or more healthy embryos are carefully selected. These chosen few then embark on a journey back into the woman's uterus. This is done using a thin catheter, a soft and flexible tube. The process is meticulously carried out, with the ultimate hope that the embryos will implant themselves into the uterine lining, marking the start of a pregnancy. After this crucial stage, patience becomes a virtue. A couple of weeks are allowed to pass, a period filled with anticipation. Then comes the moment of truth, the pregnancy test. This test is designed to detect the presence of a hormone known as HCG, which is produced when an embryo successfully implants itself. And so, with the result of this test, we learn if the IVF procedure has been successful, and that, in a nutshell, is the process of IVF. Now that we understand the process, let's explore why people opt for IVF. In vitro fertilization, or IVF, is a beacon of hope for many couples struggling with infertility. It's often the go-to solution when other fertility treatments have not yielded the desired results. Its uses are wide-ranging, addressing issues such as blocked fallopian tubes in women, which can prevent the egg and sperm from meeting. It's also used when there's a low sperm count in men, which can hinder the chances of fertilization. IVF can even help when ovulation disorders are present, affecting the release of eggs from the ovaries. And in some instances, when the cause of infertility remains a mystery, IVF steps in as the knight in shining armor. From start to finish, IVF is a journey of science, hope, and the dream of parenthood.